Yes, greetings everybody. So today we're going to look at our first module for the Masterclass Certificate in Mental Health Studies, which we are running from now to December. And today's presentation that we have is Introduction to Mental Health. And this is the outline of our presentation: Introduction to Mental Health, SDG and Mental Health, Dimensions of Mental Health, Importance of Mental Health, Common Mental Disorders, Factors Affecting Mental Health, Signs of poor mental health, promoting mental stigma in mental health, global cultural perspective, and also local conclusions. So what is mental health? Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can also be productive and fruitful, and can make a contribution to his or her community. So mental health is a critical component of our overall well-being, encompassing our emotional, psychological, and social aspects of our lives. So it influences how individuals think, feels, behave, relate to others, handle stress, and how we make choices. So mental health is essential at every stage of our lives. That is from pregnancy to we even exit this earth, that is adulthood. So yes, what is also WHO look at mental health refers to a person's cognitive, emotional, and behavioral condition. It is more than just the absence of mental illness. It involves maintaining a state of well-being where an individual, one, I emphasize that, realizes their own potential, what you can do better. Two, copes effectively with the normal stresses of life in a day. Then three, works productively and fruitfully. Then four, contribute to their community. This is just to reaffirm the definition for mental health. So which of the sustainable development goals emphasize more on mental health? SDG 3, which is good health and well-being. Let's look at the aspect of SDG 3 that really emphasize on mental health. That is SDG 3.4. But before then, let's look at the Sustainable Development Goal 3, good health and well-being. It is the primary goal that directly discusses mental health, aiming to ensure healthy lives and promotes well-being for all at all ages. So SDG 3.4 by 2030, and we have, this is 2025, some 5 years to come. By 2030, this SDG 3.4 they want to reduce by 1/3 premature mortality from non-communicable diseases through prevention, treatment, and promote mental health and well-being, which we are almost there. Yes, so however, UN 2030 agenda acknowledges that mental health is also affected by these SDGs. SDG 1, that is no poverty. Then quality education, which is SDG 4. Gender equality, SDG 5. Then decent work and economic growth, SDG 8. They all contribute to mental health and well-being. Yes. So SDG 3, good health and well-being. This is the main SDG that discusses or addresses mental health, and it aims to reduce premature mortality from non-communicable diseases, including mental health and substance use disorders. The focus is to promote well-being and calls for the prevention and treatment of mental health conditions. Other SDGs, which is no poverty. So no poverty, which is SDG 1, talks about poverty can significantly impact mental health, and this goal addresses it through social protection and other measures. SDG 4, quality education. Access to quality education and supportive learning environments can foster mental well-being. Is that not true? This is true. SDG 5, gender equality. Addressing gender disparities can improve mental health outcomes, particularly for marginalized groups. SDG 8, decent work and economic growth. Factors like unemployment, poor working conditions, and economic instability can negatively affect mental health, which is true. Unemployment rate on the continent of Africa is very high. SDG 10, reduce inequalities. Reducing social and economic inequalities can lead to improved health and well-being for all. Yes, so let's watch out for the next. So in continuation, we are looking at dimensions of mental health. So the dimensions are three. We have emotional well-being dimension, psychological well-being dimension, and social well-being dimension. So the emotional well-being dimension, the ability to manage emotions like happiness, sadness, anger appropriately is very key to ensuring that your mental health is okay. The psychological well-being or the psychological well-being dimension encompasses self-esteem, resilience, and the ability to manage thoughts and behaviors. These thoughts are what come in mind, and we exhibit it through our behavior and other actions. Social well-being as a dimension, the ability to form satisfying interpersonal relationships and maintain social connectedness is very key. All of us needs to be in a relationship that can help us improve upon our mental. So when you are in a strong and healthy relationship, it helps you mentally. But if you are in a relationship that is not good, it does not help you. And this is why most people have mental health problems. Importance of mental health. Yes, when we're looking at this, we're looking at the importance of this. So it improves our physical health, relationships, productivity and performance, then quality of life. So physical health, mental and physical health are deeply interconnected. Poor mental health can lead to physical and other health issues such as heart disease, chronic pain, and weakened immune function. And this is very key. So we have to make sure that our physical health is okay for our mental health to also be okay. Yes. Relationship, good mental health supports better communication. So your relationships, if you have a better relationship, you talk to your partner, you talk to your friend all the time. Yes, empathy, you surely be in readiness to empathize with that person. And cooperation in relationship, sometimes you need to compromise because you have to make that person okay. Productivity and performance, individuals with strong mental health are more focused, creative, and effective in their personal and professional lives, and that is good. So people who are having poor mental health will not be performing better personally and also at their job roles, at their workplaces. Quality of life, mental well-being significantly contributes to an individual's overall satisfaction and happiness. Yes, and this, your quality of life will either be improved or not. Common mental health disorders that we want to look at. While everyone experiences emotional ups and downs, which is sometimes normal, some individuals may face mental health disorders that require attention and care, as well as treatment in the facilities. Yes, so let's look at some common mental disorders here. Depression, anxiety disorder, bipolar disorder, schizophrenia, obsessive compulsive disorder, and post-traumatic stress disorder because of the current happenings. So what is depression? The case definition for depression: a persistent feeling of sadness, loss of interest, and lack of energy can be seen as depression. But this should be diagnosed by a medical officer, a psychiatrist, or whoever is given the capacity to do that, a mental health professional. So what is anxiety disorder? It includes some components such as generalized anxiety, panic disorder, phobias, and social anxiety. Social anxiety, when the person wants to go out, the person will be feeling tense, apprehension, and so on, worrying because they have that kind of social anxiety. They can't go to public. Yes. Bipolar, characterized by extreme mood swings between mania and depression. So the person experiences manic symptoms where they get too happy, or depressive symptoms where they get too low. Yes, schizophrenia, a severe disorder affecting thinking, emotions, and behavior, often with delusions and hallucinations. Obsessive compulsive disorder, which we call OCD, yes, involves unwanted recurring thoughts and repetitive behaviors, which is what they do. If it's about bathing, the person can bath 10 times, 30 times, 50 times a day. Or the person will be walking out, come back, that is OCD. Have I off my iron? Have I off my TV? Have I done this? Have I done that? Have I done over and over again? Then post-traumatic stress disorder, triggered by experiencing or witnessing a traumatic event like an accident or maybe a murder case or whatever. So the person will be having those recurring or triggering that kind of thought in mind, and it makes the person go down. So they'll be having some stress as a result of happening to be thinking about what they have experienced. Yes, next, factors affecting mental health. So several factors contribute to mental health, both positively and negatively. So biological factors, in their normal state, is positive, abnormal is negative. So genetics from parents to offspring, brain chemistry, that is more importantly, neurotransmitting systems where we have the chemical balances and imbalances, or a physical health condition can impact positively or negatively, which is more sometimes negatively on your mental health. If you are diagnosed with a chronic medical condition like HIV, hepatitis, heart disease, liver disease, kidney disease, it will surely impact negatively on your mental health. Life experiences such as trauma, abuse, rape can significantly change one's life, and it will affect your mental health negatively. Yes, family history. A family history of mental health conditions may increase the risk of one developing the mental disorder. So when your parents are diagnosed with mental disorders, or your co-siblings, the possibility of you getting mental illness, if the protective factors are not there enough, is very high. Then social environment, support systems, economic status, and cultural factors play a major role. Some of us, our cultural factors are very negative, that they affect us negatively when it comes to our mental health. Some of us, our cultural factors are very positive, and they serve as a protective factor. Then economic status, if you are below average, very poor, average, then very rich, it also has some implications. That does not mean that people who are rich don't get mental illness. They also get, and those who are poor also get, those who are average also get, depending on whichever level you find yourself. Signs of mental health problems: 1, persistent sadness or irritability. 2, withdrawal from friends and activities. 3, changes in eating or sleeping patterns. 4, fatigue or lack of energy. 5, difficulty concentrating or making decisions. The next one, feelings of worthlessness or guilt. You blame yourself sometimes. You feel like you are empty. And then thought of self-harm or suicide. The person always think about ending his life because of what he's going through. It is a mental health problem or a mental health issue. Let's find out what are the things making you think like that. Yes. Promoting mental health. How do we promote mental health? Mental health can be maintained and improved through various practices such as self-care, mindfulness and relaxation, healthy relationships, professional help, avoiding substance use, and also building resilience. Let me just wrap up with this. So self-care, prioritize sleep, nutrition, and exercise, very key. Mindfulness and relaxation, you meditate sometimes. Some people do yoga, breathing exercises, and so on are very helpful. Healthy relationships, stay connected with supportive people, not those who will not support you. Stay connected and make good friends. Yes, it's very important. Professional help. When you think you can't go anymore, seek professional help from mental health nurses, mental health officers, clinical psychologists, counseling psychologists, psychiatrists, pharmacy psychiatrists, and seek help with whatever you're going through. Avoiding substance abuse. Drugs and alcohols can worsen mental health of our people. So stay out so that your mental state doesn't get worsened. Building resilience. Learn coping strategies for stress and other adversities that may hit you in your life. Stigma and mental health. One of the greatest barriers to mental health care is stigma. Many people with mental health conditions face discrimination, which may discourage them from seeking help because you are discriminated. You don't even go out there. So what we have to do is to educate, have empathy with people with mental disorders, and have open conversation about their predicament, and also help them get better. And this is key to breaking the stigma that we currently experience in our community. Are you enjoying our lecture? Let me hear from you. Global and cultural perspectives. Mental health is a global issue. And on the continent of Africa, 160 million people are living with various forms of mental disorders. So if you distribute, that means that every country have over 2 million whatsoever, depending on your population. Then yours may reduce, others may jump up. Ghana, as we speak, we have over 2 million people. I think WHO, the data I saw, 2.4 million. Yes, people live with various forms of mental illness in Ghana. So yet its understanding, that is the understanding of mental health and treatment, vary across cultures. In some cultures, mental illness is heavily stigmatized. They don't even see it as an issue to address. And in others, they incorporate it to our community-based healing methods. The World Health Organization emphasized that the importance of mental health should be as key to we realizing the universal health coverage component that we are all addressing. In totality, mental health is fundamental to overall health and well-being. It affects every part of our lives, from how we think and feel to how we interact with others. So right now, if things are not going on well, everything changes. While challenges to mental health are common, they are also manageable. We can manage them with the right support, care, and resources. So what do we want to do? Bringing this course means that we want to raise awareness, reduce stigma, and promote positive mental health practices at the individual level, community level, to foster a healthier and more resilient community. On this note, if you have not signed up, register for our 12 weeks ongoing Masterclass certificate in mental health studies and learn something on mental health. Thank you very much.